Hi, I'm Dr. Jeff, and in this video I'm going to talk a little bit about our custom foot orthotics for the treatment of plantar fasciitis or pain on the bottom of the foot. What you can expect when you come in for an orthotic evaluation with us. Plantar fasciitis is a very painful condition. It usually affects the bottom of the foot. It could come on by running too long without arch support. There could be maybe one traumatic event where you stretch the bottom of the foot a little bit too much and the plantar fascia or the muscles on the bottom of the feet tear, or it could be a gradual thing that develops over time. It could even just develop from normal walking every day on the hard surfaces. A lot of the surfaces we walk on right now just are not very friendly to the feet. So typically if you have plantar fasciitis, you're going to have pain a lot on the bottom of the foot. Sometimes it's a lot worse in the morning. You may wake up in the morning and when you get out of bed and the first couple of steps you take to get out of the bed, you experience a lot of pain on the bottom of the foot. As you walk around a little bit as the day goes on, that pain may reduce a little bit. And that's because what you have in the plantar fascia or the muscles on the bottom of the foot, you can develop little tears and adhesions. And over the night when that is not being stretched or non-weight bearing, it could kind of hold that arch in this position. Then you get out of the bed and it collapses that arch and you get that pain on the bottom of the foot. Now, one of the first treatments for plantar fasciitis or pain on the bottom of the foot is arch support. There are many other type of conditions as far as any type of like injections, ultrasound, deep tissue type of therapy, mobilization to the ankle or to the hip joint. However, if you don't have that arch support, more than likely that pain on the bottom of the foot is going to come right back. If you're laying on the table and we're doing deep tissue therapy to your calf or the bottom of the foot, an ultrasound or muscle stim to your foot. However, the second you get off of that table, if there's no support in the arch, that foot's going to drop and it's going to stretch that fascia up on the bottom of the foot and lead to more pain. So the way we treat plantar fasciitis is with a custom foot orthotic. What we do is we have you come in here for a consultation and we're going to look at your arches. We're going to measure your feet in a non-weight bearing stance and see how much arch you have. Then we're going to actually have you stand up and see if one arch is collapsing more than the other. We're also going to check out some things as far as the ankle mobility. Is your ankle too rigid? If your ankle lacks flexibility or mobility, that could lead to other issues with affecting the plantar fascia. We're going to look to see if you have any type of trigger points or muscle weakness in the calves or in the foot. We're also going to measure what we call a Q angle, which is an angle between the hip and the knee. Having an increased Q angle can put a lot more stress on the bottom of the foot. So when you come in for an evaluation, we're going to look at it a little bit more than just the pain on the bottom of the foot. We're going to do a lot more than simply have you step in a foam impression clinic like some clinics do. We can make, the orthotics we make are specific to you and your condition. We could increase the rigidity of the orthotic or make it semi-rigid or more pliable and a little bit more flexible. We could add heel cups and heel wedges into the orthotic. It is definitely not a one-size-fits-all. Based on whether or not you're running, you're walking, what type of shoe you're going to put in the orthotic in, that's going to determine what we're going to actually make the orthotic out of, how rigid we're going to make it, whether or not we're going to put a heel cuff, how high we're going to build the arch. When you come in for an orthotic evaluation for us, you're coming in and you're having a consultation with me. I'm a sports doctor. I wear the orthotics myself. One thing I tell all my patients is I would never sell anybody something, a supplement or orthotic, a form of treatment that I haven't tried out myself. I personally have a degenerated knee, chondromalacia patella is called, and I also had plantar fasciitis. So, and I'm a long distance triathlete. So I'm always looking for something to give me a little edge, to keep me running, to keep me biking. And these are the orthotics that I have chose to use for myself. So if I feel that they're good enough for the orthotics to use for myself, they're good enough to recommend to my patients. If you have any questions about the orthotics, please feel to give me a call. Otherwise, if you have a condition with the foot or the plantar fasciitis, give me a call, set up a consultation. Right now we currently charge $185 for everything. That includes the evaluation of the orthotic, the fitting of the orthotic, the actual orthotic itself. A lot of people want to know why our orthotics are only $185 and other clinics are charging $500, $600 or more dollars. The honest answer is that's just what we choose to charge. As far as quality goes, no difference as far as the quality goes. Like I said, these are the orthotics that I'm using myself when I run, and it's a nice quality orthotic to help your plantar fasciitis. So if you're suffering from plantar fasciitis or think you might be suffering from plantar fasciitis, give us a call, schedule a consultation. There's no charge for the consultation. If you decide to get an orthotic, the cost for that would be $185, which would include, like I said, everything, the doctor's consultation, the fitting, the actual orthotic itself. And another thing about orthotics is once our orthotics are made, you're not stuck with that specific orthotic forever. If we need to, we can always send that back to the lab, increase the arch, decrease the arch, change the wedges around, change the top cover. You have 6 months from the day you purchase the orthotic where we can make any type of adjustments to the orthotics. The orthotics are guaranteed up to 5 years. I personally have had my orthotics that I have in my shoes right now for about 5 years. I have a second pair of my running shoes that I just use for running, and I've had those for 2 years. And the orthotics I've done 5 Ironmans, 3 marathons, and they hold up extremely well. So if you have any questions, just feel free to give us a call.